I'm Dr. Terry Mason. I'm a retired urologist, but I have also been working the last 10 years in public health. First as the Commissioner of Health for the City of Chicago. Then I've come over to the County of Cook, where I worked as the Chief Medical Officer for the entire Cook County Health and Hospital System. And then I was actually blessed to have a brief stint as the Chief Executive Officer for the entire county system. And now I work as the Chief Operating Officer for the Cook County Department of Public Health. And for those that don't know Cook County, it's about 5 million people. The county is about 1,700 square miles. And there's a little city in there called Chicago that's part of Cook County. I had patients all over the place. It was a very successful practice. But what I learned is I didn't feel comfortable knowing that I was taking pieces out of people. And taking pieces out of people, what did that really fix? I took the pieces out, and I was good at taking the pieces out. And I also gave them drugs. But what really got me is that I never did anything for the reason that the pieces needed to come out or the things that I was giving them the drugs for. I wasn't doing anything at all to change the basic problem that was going on. And that was because I didn't know it. I didn't know it. I was never taught that. I went to medical school, U of I, the University of Illinois in Chicago. I had 40 minutes of nutrition in 4 years of medical training. Not just me, all of us. That's just the way it is. We as physicians are not trained in real nutrition. I mean, I learned a little bit about nutrition because we used to wonder why the patients from surgery weren't doing well. Well, I said, well, okay, so we brought them in, we starved them before surgery, we starved them after surgery, and then we wondered why the wounds didn't do what they were supposed to do, and they didn't do as well because we were giving them dextrose or sugar water for almost 12, 13 days and nothing else. And we've done major insults, these big surgeries on them, and wonder why they didn't do as well. We didn't understand nutrition. We started using intralipid, which is a fatty substance, and we started giving them protein mixes and stuff like that. And guess what happened? They got better. Now, they probably would have gotten even better if we'd known what to have them eat, which would have prevented them from having disease in the first place. And that's where I want to live now. That's what I want to spend the rest of the years that God has for me on the planet, really getting us as people, us as medical professionals, us as everyday people concerned about what they can do. And what we can do is that the human body, John, is perfect. We don't have to worry about regulating our electrolytes. That's what our kidneys do. We don't have to worry about making bone because that's what our marrow does. We don't have to worry about any of those things. All we need to do is give it what it needs, and it'll do that. If we eat stuff that is creating some sort of toxic interference with all of our cells are constantly remaking themselves. We get new blood cells every so often. We get new skin cells. We get new cells that line our colon and our stomach because that's the way it's set up. But when we eat things that interfere with that normal process, then we have problems that we call cancers. Because what are cancers? They're just uncontrolled growth. As we've made the planet sick, we're getting sicker ourselves. As we've tried to extract in unnatural ways the mineral ores and the things that we've created value around, like diamond and gold and all that other stuff, and coltan for what we use now for cell phones, as we've done that in a way that is not environmentally safe to Mother Earth, Mother Earth is now producing toxic children. That's us. So I want to say that one of the things as a physician, and hopefully with the credibility of a physician, that I can say to people, look, the way we've taught you about thinking about disease is wrong. You don't have a heart problem and then a brain or a stroke problem or a circulation problem. That's not the truth. The truth is the way you've eaten is damaged the blood linings, the lining of the blood vessels in your entire body. You don't just have damage in the heart or damage in the brain. Vascular disease or any problem with the blood vessels, everywhere there's a blood vessel, you've got that problem. So if it happens in the kidney, it's happening in the heart, it's happening in the brain, and what we're talking about are those downstream sort of things. We talk about a heart attack. Well, a heart attack has absolutely nothing to do with the heart early on. A stroke has absolutely nothing to do with the brain. And peripheral vascular disease, where you throw a little clot and your toe turns black, has nothing to do with the toe. It has to do with the process that caused that. And that, if I don't say anything else, is directly, inextricably related to the kinds of foods we're eating. But in addition to the foods that we're eating physically, we have to think about what types of foods and messages are we taking into our brain and into our spirit. Because change doesn't happen with just knowledge. Change is a mental and a spiritual decision. Because when you are faced with trying to go back to the things that you know you're not supposed to do, it is going to be not the fact that you know better that will stop you. It's the fact that you believe that you can do better, and you believe that these things are doing bad things, and you believe that you've got the power endowed by our own Creator to say no and to do the right thing. That's when it's a belief, it's ideals, it's those things that have built the world. It's the Wright brothers, whoever you want to give credit to, that decided they could make something that could fly. Nothing was flying, but they decided they could. It's the belief that we could build a building that's 96 stories when there wasn't any such thing. All of these things started as a belief and an idea with men and women who decided they would overcome all and any obstacle that got in their way to make this happen. 50 years ago, no one would believe that we'd be living in a point in time in the city of Chicago where I could go into a bar and no one smokes a cigarette, where I could sit on a plane and no one's smoking a cigarette, where I could ride a bus and no one's smoking a cigarette, that I could go into any of these public places and no one's smoking a cigarette. And guess what? We didn't fall off the planet. Everybody's doing better as a result. And I'm saying that I believe, and I believe that the American people and people all over the world believe, it's not that we don't have the ability to do it, because before we did all this other stuff, we ate quite well. There is no way to medicalize ourselves out of this condition. Now, what I think is really driving it is the value proposition. There's no core value proposition in America for curing anything. The core value proposition is for managing disease. So I don't want to cure your diabetes, I want to manage it, because now when I was in training, and probably when you were in training, other doctors were in training, type 2 diabetes, we didn't call type 2, we called it adult onset, because you didn't see it until people were 55 and 60 years old. Now you see this diabetes happening in teenagers and perhaps even younger as time goes along. What happened? Why is that the case? To some who may make agents that they use for treating diabetes, now instead of getting somebody at age 50 and maybe getting them to take stuff for 15 years, now they're going to get them at age 15 and maybe taking stuff for 40 years. So there's some misalignment of value propositions. Do I believe we should use medicines? Absolutely, I think we need to use medicine. Do I think there's a role for surgery and stents and things of that nature? Absolutely. In an acute situation, those things should absolutely be used. But they should not be marketed as cures. They should be marketed for what they are, and that is temporary control. Do I think we cure cancers by the surgery? Well, I certainly stopped believing it, because I saw if I really believed that the cancer was cured, why'd I have the person come back? Why did I need to check this test or that test if I thought it was gone for good? It's not gone for good. We've just controlled it for the moment. And I think that the American people need to be told the truth. I think that we need to understand that we're not going to medicalize our way out of our current condition. And if we have any compassion at all for our future, if we believe that we want to have a solid future, not a future as it is right now, where even the armed services, 60% of the kids can't even pass the physical fitness exams, or their reading scores or what have you aren't where, and math scores aren't where they need to be. If we believe that we want to be the country that's the leader and not the tail, and right now America's losing that edge. If we want to be the country that produces very physically fit Because if they're not physically fit, they won't be mentally fit. And if they're not mentally fit, they won't be spiritually fit. And if they're not spiritually fit, we're going to get leadership that'll continue to take us down the path of destruction. I happen to believe there are enough people out there in the world who want better and will demand better and will be willing to work for better. Those are the people I believe in. And that's what keeps me going, doing exactly what I'm doing right now.